We're going to bring in team 2, looking at the Integrative Oski, an innovation in assessment using the Test-Retest model. Boy, I remember in dental school I had a lot of retests, and we didn't have those Oskis, I'll tell you that. Okay, let's welcome Barbara Cortright, a second-year student in the Physician Assistance Program, and her faculty mentor is Dr. Bob McMullen. Welcome.
Hi, my name's Barbara Cortright. I'm a second-year PA student. I'll graduate in 2016. And I've got a new way to test medical skills for the PA program. It's called the Integrative Oski. And in just a moment, I'll tell you, for the few of you who don't know what an Oski is, I'll explain that. Here's what Medical Skills Lab looks like for our PA program. Those are my fellow students. This is where we learn psychomotor clinical skills such as CPR, bag valve mask ventilation, injections, anything that's hands-on, strangulation. So what we do in the skills lab is that an instructor demonstrates the skill. We practice it a few times. Then we perform the skill for the instructor, who signs off on a checklist and says we've mastered the skill. Then it might be several months before we actually use the skill on real patients. How do you know that once we go out and treat real patients that we've retained the skill and can perform it adequately? The problem is we don't really know. So I'd like to change that. This on the right is handsome Dr. Simon. He's the chairman of our PA program, and he's worried. He's worried that when we go out and treat real patients that we won't have retained these skills. So this is what I propose. The skills are tested in a skills lab, right? And then we have something completely separate from it, and it's called the Oski, or the Objective Structured Clinical Examination. And that's where we play the role of a healthcare provider, and we have a standardized patient who plays the role of a patient. And this is as close as we get to real life. This is as close as you instructors get to determining how well we are doing as healthcare providers. You do your very best to test us on medical skills in the skills lab, but those are not incorporated into an Oski. So really, medical skills testing is completely apart from the patient encounter. What I propose is that we integrate these two. We should integrate medical skills into the Oski experience. See, the skills with the Oski, that would be an integrative Oski. So not merely a patient encounter with the Oski, you would incorporate something like an EKG or blood pressure monitoring. So you have the entire spectrum of activities that a healthcare provider would do. So the normal sequence of events for an Oski is that a student will go into an exam room. There will be a standardized patient there who is somebody who's paid to play the part of a patient, and we students play the part of the healthcare provider. We have all the details written on the door, so we know what we need to do. And then that's the end of it. What I would like to do is integrate the use of medical skills into this realistic scenario so that we can really tell if we retain these skills when we go out in the real world. Right now, we're just tested in the skills lab, and that's the end of it. So with an integrative Oski, it would be a much more realistic situation for testing these skills. The integrative Oski would be in line with what instructors in medical school are always trying to do. They're always trying to test us in the most realistic situation possible. That's why we use cadavers in the anatomy lab. That's why we have standardized patients. We're always striving for realism. And that's how you know whether we can do our jobs. what I propose is a small trial of this idea. The details will be as follows. Who would be involved? They would be 3 first-year PA student volunteers. And I would choose those that don't have any experience doing particular skills before PA school. That way we could really assess how well we've instruct them to do medical skills. So these are the ones that I would choose. Now for this Oski, they would be the student, and the standardized patients would be members of the pre-PA ASU club, because I'm sure they would do it for free and they would love to give us their time and get exposure to this program. The preceptors, the people evaluating this, would be paid adjunct faculty. So which skills would I try for this small trial? I chose the simplest, most inexpensive skills that are extensively used in primary care: blood pressure monitoring, intramuscular injection, and EKG. How would I set up this trial? 3 exam rooms. In each room would be an entire patient encounter with one of the skills. For example, exam room 1 could have blood pressure, exam room 2, EKG, exam room 3, an intramuscular injection. And the students will be required to do the entire patient encounter plus a skill with the preceptors standing in the room. And after 20 minutes, the preceptor would give immediate feedback and demonstrate the skill if necessary. This would be a much more realistic test of whether we PA students have retained these skills. When would I do this trial? I've selected the last semester for the first-year PA students that they're on campus. This is the semester right before they'll go out on clinical rotations and actually be using these skills. The first date would be June 5th, and 6 weeks later will be the second date to see if they've retained the skill. This will give us an idea of whether that testing was effective and whether our teaching methods are effective. And where would I have the test? I would have it at the Patch Clinic. Patch Clinic is a real medical clinic run by Dr. McMullen, and he's graciously set aside these times for this trial. Not only is Patch a real medical clinic, it's also easy to use because we wouldn't tie up school facilities for this trial. And it would be a real medical clinic. So, how is this idea innovative? Well, the integrative Oskis would be a new way to assess medical skills in the context of a patient encounter. In a realistic scenario, using a time pressure and a test-retest format. The project is ready to implement. All the scenarios are written, all the grading rubrics are in place. The only task to complete is to select participants. No assistance from full-time faculty would be needed. An impact. This small trial could have a large impact. We could get us started thinking about how we assess medical skills and how we teach medical skills. It could be expanded to use other skills and use more students. But the best part of this trial is the cost. $5,000, don't be silly. $4,000, you're crazy. $3,000, get out of town. $2,000, not even. $1,680.94. And if you want to throw in pizza, that'd be an extra $20. But the best part is the greatest expense is simply paying adjunct faculty $50 an hour, 12 hours, and the rest would be for miscellaneous supplies. Most of the equipment we could borrow. So this would be a very, very low-cost trial that could get us started in a new direction for testing our medical skills, and it could be expanded in the future and have a terrific impact on the PA program. So the Integrative Oski would be a small and expensive first step to see how well PA students retain the medical skills they're taught, but it could also have a big impact on how they're taught and assessed in the future. So, any questions?
Well done. Yay, Barb. Thank you. Let's see if we have any questions from our judge. Thank you. That was well done, and thank you for the treat. That was very sweet. Okay, let's go. Beth, question, please.
The bread was fabulous, Barbara. Thank you very much. That was definitely gave you the leg up from the start. Thank you for the presentation. Firmly believe in the clinical component is difficult in that transition. Question, the award is $5,000. You're only looking at 3 students at a minimal cost. Why not try to do this with a larger number of students? Because the funding is available. And tagged on that, how would then this be ramped up to cover all of the students eventually?
Well, I knew you would ask that question, but it's always easier to spend more money than to save it. So if $5,000 is available, I would start with this small trial, and it could easily be expanded to more students and different skills. So I wanted to start small and then fine tune it so that we use the money in the best way possible. The money, the $5,000, would be used almost exclusively to pay adjunct faculty.
Great. Oh, very good. Thank you. Let us get Norm, and then we'll go up to Ted.
He's younger than I am.
Yeah. Only by a few hours.
If you want this program implemented, why would you use adjunct faculty? Why wouldn't you use full-time faculty so you could get buy-in in order to change the curriculum?
Because I know full-time faculty are overloaded, and if I really want this project to be approved, I would start it on a small scale for minimum amount of time from full-time faculty and minimum amount of money, and then let's see where it goes.
Cool. Ted?
I've got a number of questions, but I want to start. I want to start with the number 3 subjects. Do you really think you're going to learn anything from 3 experimental subjects? And then the second part of that, and there's a third question, but the second part of this is I'm not exactly sure how to ask it, but 3 subjects doesn't seem like enough. And I wonder about the need to get IRB approval to do this kind of a test or an experiment.
Pilot. Yeah.
I'm not sure of the approval process. I'm not an educator, but I think 3 would be a good place to start. I would like to start small and then ramp it up if it's successful, because that's really the point. And I figure it'd have a better chance of being approved if it weren't much money.
Cool.
So,
Thank you.
let me ask the third question. Our standardized patients are volunteers,
Yes.
and it's kind of easy to get volunteers to come in and act sick.
Yes.
It's another thing to ask somebody to come in and to undergo an invasive procedure like an intramuscular injection or an IV injection or something like that. Have you considered that?
Yes, that's why I chose the simple skills to begin with. If anything is invasive at the beginning, I would use a mannequin arm for anything, because we want to avoid liability of any sort.
One more question.
Yes?
Sorry.
That's all right.
Bob, we got time for one more question.
Barbara, nice presentation. Good sense of humor, by the way, too. I think that I'd like to know how you will evaluate this at the end. I understand you'll have the preceptors in each case. Is there some standardized or objective criteria to see how the evaluation of the success or failure of this process?
Yes, we already have standardized grading rubrics in the program, and we would use those grading rubrics. And then we'd compare the mean score between the first and the second test to see if there's been retention or improvement.
Great. Thank you. Barbara, thank you very much. Let's give it up. Thank you. Great job. Well done. And